It's said that necessity is the mother of invention, and that timeless wisdom is proven yet again by AHA's Innovation Challenge. Just ask Parkview Health of Fort Wayne, Indiana. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, senior writer at AHA and your podcast host. In 2018, the American Hospital Association launched its inaugural Innovation Challenge. Open to every member hospital or health system, the challenge is an open competition among participants to share their creative approaches for redesigning integrated care delivery. Their ideas and solutions are targeted to populations with complex needs. The health challenge assigned to these competing teams changes every year. Last year's top winner was Parkview Health of Fort Wayne, Indiana. Its submission, which also won Parkview a $100,000 prize, offered a different approach to helping a vulnerable population of opioid use disorder patients in Northeast Indiana. Parkview's brainstorming blended peer coaching, primary navigators, and a mobile app that combined helped to unify the fragmented system of care provided to their opioid use disorder patients. That is the value of innovation. And it was the subject of a recent discussion between Ben Miles, president of Parkview Health, and Dr. Jay Bott, senior vice president and chief medical officer at AHA. The two men had a chance to sit down at AHA's annual meeting in Washington, D.C. in early April.
Hi, I'm Jay Bott, Senior Vice President and Chief Medical Officer at the American Hospital Association, and today I'm joined by Ben Miles, President of Parkview Regional Medical Center and Affiliate. This year we're really excited to launch another Innovation Challenge building on the success of our inaugural Innovation Challenge last year that was about high-need, high-cost patients and how do we redesign care pathways and delivery for them. This year, really excited about engaging in a conversation that we're hearing a lot about, that's social determinants of health, and how do we enable addressing that through technology. So this second Innovation Challenge that the American Hospital Association has launched with generous partnership and support from First American Healthcare Finance is really exciting. I think there's a lot of buzz about it, a lot of conversation about it, and we look forward to engaging you in conversation about it. We want to help you think about how you might respond to the Innovation Challenge and give you ideas about what you can do by talking about some of the work that's been done by Parkview Regional Medical Center and Affiliates in Fort Wayne, Indiana. Ben, welcome to the show, and would you start by introducing yourself and your organization?
Happy to do so, and thank you, Jay, for the opportunity to join you today. So as you shared, my name is Ben Miles. I have the privilege of serving Northeast Indiana and Northwest Ohio as the president of Parkview Regional Medical Center and Affiliates. We are a 9, soon-to-be 10 hospital system located in Allen County, primarily Fort Wayne, Indiana. We have roughly 12,500 coworkers and really are looking to just make a meaningful difference in the communities that we serve. I've been with the system now for a little over 6 years, and the story of Parkview is a focus on a relentless pursuit of excellence to serve those who trust us with their care. We've experienced a tremendous amount of growth, and that growth isn't just numerically. We're looking to really refine and chase that greater level of excellence to deliver upon the promise of excellent care for every person every day.
Fantastic. We appreciate all that you're doing to advance health in your community and be really a beacon of hope, opportunity, and innovation for the rest of the field.
Thank you.
And so really excited to hear more about how you're thinking about that, the work you're doing, and appreciate your leadership. Mm-hmm. So every leader agrees that innovation is important in healthcare and other sectors, but nobody can quite seem to agree on what it exactly means. I mean, when you Google the word innovation, you get 300 million results, and its own definition is an action or process of innovation. And so when you think about it and look at it in the dictionary, one definition says that make changes in something established by introducing new methods, products, and ideas. So Ben, what would you say is your definition of innovation, and what does it mean to you?
Great question. And I think that in its best form, it's a very personal answer. As I think about going about the work of innovating what we do each and every day, probably the best place to begin is to start with where Simon Sinek took us about 10 years ago, and that's starting with why. For us, I think it's very important that we understand that the patient is at the center of everything that we do. And so really just kind of following a rote script day in, day out is no longer acceptable. Not that hospitals have really done that, but we really look to push ourselves to improve upon being better stewards of our resources and finding new ways to tackle some of the very real problems that we have day in, day out. So I look at it as a community-owned, not-for-profit of, again, just really being a great steward of those resources for us and finding ways to do it better, get better outcomes, deliver greater levels of service, and do so in a way that's helping to bend that cost curve.
Well, thank you, Ben, and I think you're spot on in how you're thinking about it. And what we've heard from different members of the field around this issue is that there's process innovation, there's technology innovation, and it's not always necessarily the new shiny object, but it's also just doing things better that create value.
Absolutely.
Right. So,
well, I think we find ourselves really just at an interesting time in our industry because we're in a great time of transition, and with change comes great opportunity. So rather than allowing that to come to us, we want to be in the driver's seat and find ways to reduce friction and actually pick up on the speed of how we improve those processes.
Great. So why don't we jump into the question of why is it important for health systems like Parkview Regional Medical Center and affiliates to get creative and become innovators?
So, I think innovation is something that if we're going to stay relevant, if we're going to continue to achieve and clear that bar that gets higher and higher every day, we're going to need to find ways to improve upon that. I think about what Adam Buller said yesterday, and he focused on CMMI's 4 priorities, and he shared that those are understanding that patients are consumers, that providers are accountable for outcomes, that payment as it's going around value is going to be tied to outcomes, and how do we prevent disease. So I think as we try to look at those 4 priorities, we need to simplify our system in a way that is going to be meaningful, opening up access, and as I shared, really trying to figure out how do we bend that cost curve through better utilization and educating and engaging the patient as a consumer.
Yeah, it was interesting to hear Adam Buller yesterday talk about how he envisions creating those spaces of opportunity and innovation in the field and designing new care models, and I'm sure that that's an important way of how you're thinking about redefining the H and delivering value for the community and for the people that are in the community trying to access care.
Absolutely. I think access, as has been shared throughout the annual meeting so far, isn't just through the doors of our physical facilities, but really harnessing technology as a tool for us as well.
Great.
Yeah.
Well, we launched this inaugural innovation challenge at the American Hospital Association last year and had a great response. And your organization performed very well in that challenge. And we're really excited about this next challenge that we have coming out this year around social determinants and technology. And so, thinking back to when you saw the inaugural challenge and the opportunity, why did Parkview Regional Medical Center jump into the challenge and that competition?
Well, I think there's a number of reasons why, and appreciate your question. I think we've enjoyed such a great relationship with organizations like the American Hospital Association, and we have certainly improved our processes based on that collaboration. We felt as though the process that we were working on, that we ultimately submitted, was a very novel process, and even just going through the submission and working through that process with AHA was going to make a great project even better. We felt as though this was a great solution, though, potentially not just for us, but something that we would be able to share with others. And one of the things I think is just a great hallmark of our industry is the ability to collaborate so openly with other organizations. I never cease to be amazed that I can pick up the phone, call someone literally across the country, and have the ability to not just discuss, but we've hosted site visits, we've gone on site visits, so we want to share openly the ideas that we're working on and successes that we're realizing, just as others have shared with us.
That's great, and really appreciate your leadership in that and sharing, because that's, I think, the power of this challenge too, is the opportunity to crowdsource ideas and examples and share that. Because we've also been talking about this notion of when you aggregate the field together, you can scale transformation, that the field can disrupt itself.
So true.
And so I think that that's a really important point.
Sure.
So could you tell us about your winning concept?
Absolutely. So we want to really go after real problems. And so one of the concepts that we have been working on is perhaps one of the greatest health crises that's facing our country right now, and that's the opioid epidemic. The Hoosier State has been particularly impacted deeply by this, and just a couple of statistics that I've jotted down here. The number of opioid-related deaths in Indiana had doubled from 2016 to 2017, and so the escalation and the pervasiveness across our community is something that we knew that we needed to take a lead role in addressing. What that translates to is, in our county, roughly one death on average every 3 days. So that impact is just wreaking havoc through families across our community. The state of Indiana has estimated that the economic impact is huge as well, costing the Hoosier State roughly $4 billion annually, which translates to roughly $11 million a day. So we have built an on-demand addiction recovery support initiative that is really technology-enabled, mobile app, and leveraged our community partnerships and affiliate resources that we already had in the community, but really pulled them together in a way that is going to provide real-time, peer-supported support for particularly individuals who are utilizing our emergency departments for opioid-related substance abuse, or particularly the other group that we've focused upon is pregnant women who are suffering from opioid abuse as well, and trying to bend the curve of the impact on infant mortality and neonatal abstinence syndrome.
Yeah, it's incredible. Congratulations for the great work that you have led and the team there, and this notion of the community coming together with the health system to imagine and create a better future.
Absolutely.
And so I think that there's a great intersection of opportunity in addressing maternal health, so the health of mothers and babies, and the opioid crisis. And both of those are issues that the American Hospital Association is deeply engaged in through our Stem the Tide campaign on the opioid epidemic and better health for mothers and babies. So we really appreciate the work you're doing in this regard.
Thank you very much. Well, as you said, it's going to take all of us, and I think the collective efforts are really starting to make a meaningful impact.
We'd be really interested in hearing about what's happening with your project now. 9 months out since our leadership summit last year, where we announced the winners, and tell us a little bit about what's happening with the project.
Absolutely. So we're very pleased that we've been able to see some meaningful impact in our community. Since we launched these efforts, we've had more than 550 individuals meet criteria for enrollment in our peer support program, and of those, roughly half have been engaged with a peer recovery coach. Those who have been engaged in this process have the ability to provide feedback, and they feel, and have provided us information that they feel more connected and supported in the treatment. And I think why that's important is that there's such a stigma and isolation and self-blame that becomes a barrier to recovery. We have continued to pursue ways of scaling this program, looking to take it outside of Allen County, which is where Fort Wayne is located, to the surrounding counties regionally. And as you mentioned, Jay, we're collaborating with other affiliate entities. Park Center, who recently became a part of Parkview Health, is a well-established, wonderful partner, a community mental health center, who's been doing great work within our community. Collaborating with others, University of Illinois Chicago, Dr. Dennis Watson, and just many, many others. And I think that the program successes that we've realized are showing that we're making a big difference in the community. We're also working to share with others. So since the summit last year, we've presented at 8 other conferences, and not just to share what we've done, but also to look to get feedback on how we can improve upon the process that we have.
That's fantastic. Really appreciate you sharing that. It gives, I think, the field a sense of how this kind of work can build and grow, and how you can bring different partners together to continue to make an impact on the issue. So, Ben, what I see is that you've created an environment that fosters a culture of innovation in your organization and with your partners. And health system leaders are thinking about that a lot.
Mm-hmm.
So what advice do you have for them about how do you create an environment that fosters a culture of innovation?
So I think that it has to begin with a great level of intentionality. I don't think that this just happens. And with all due respect to the wonderful institutions we have across our country, I don't know that Parkview Health is on everyone's radar. And I think that we've shown with enough tenacity, collaboration, and intentional investment that anyone can truly make a meaningful difference, and it's about all of us working together. We've enjoyed tremendous board support, and our boards are filled with community and business leaders. Our CEO, Mike Packnett, is a visionary health system leader who has really helped us to have world-class aspirations and make a difference in terms of how we're making a difference in our community with these and other types of issues.
Great. And before we close here, Ben, anything else you want to share about how we accelerate scale and spread of initiatives that work?
So I think a big part of this is just finding ways to tell our story and fostering ways of us to make these connections. I think that AHA is a catalyst for making this work happen. I think through the meetings that we have, the webinars, this podcast, I think the more that we can do to really show how we're making an impact and giving others the challenge of saying how do they adopt these practices, even a small test of change can make a difference. We need to measure that, improve upon that. But I think it's really coming down to our intentional efforts to innovate new ways.
Great. And how has the Center for Health Innovation at the American Hospital Association launch been resonating in circles you're engaged in?
So, Jay, I think using things like MarketScan and the other resources like Telebehavioral Health Playbook that you've offered, it's where we can contribute and learn from others along the way on what tools we have to disrupt the care that we're providing.
Great. Well, we really appreciate the work that you're doing, the leadership
and
innovation you're providing. Mm-hmm. And you're right. I think the Center for Health Innovation has a series of tools and resources that help accelerate an organization's journey in building a culture of innovation and making a difference on the issues that we care about, and that's the health of patients, families, and communities.
That's right.
We're excited to be working with you and many others around the country on helping spur innovation.
It's been a privilege to be a part of this challenge, and we hope that our example is contributing to other health organizations and inspiring others to engage and become a part of this great process.
Thank you, Ben. Well, we really appreciate you and the team at Parkview Regional Medical Center Affiliates jumping into the challenge last year, and hope that this conversation encourages others to jump into our innovation challenge we've launched this year on social determinants of health and using technology. And we're really grateful to First American Healthcare Finance for supporting the challenge this year as they've done last year. And we really look forward to seeing what comes from the field, because I think there's just going to be some awesome ideas.
Absolutely.
You've been listening to a discussion on the promise and value of innovation between Ben Miles, President of Parkview Health, and Dr. Jay Bott, Senior Vice President and Chief Medical Officer at AHA. AHA's 2019 Innovation Challenge is seeking ideas about the uses of technology to address social determinants of health. Interested participants can register through May. For more information, visit www.aha.org.